Greetings, I'm Nick Shubiak with the SAMHSA HRSA Center for Integrated Health Solutions, here to talk with you today about shared care planning. Safety net primary care providers within integrated behavioral health services take on the challenge of working with multiple agencies, collaborating with diverse teams, and helping patients with complex health concerns. The shared care plan can really help streamline this process. And so a shared care plan, also known as an integrated treatment plan, is the central document that brings together all of the patient's goals, health information, and treatment providers. The shared care plan really has three components, and these three components ensure that, one, the patient receives one consistent integrated approach to care. Two, the patient and providers are working from one set shared of health goals. And three, team members are aware of all clinical treatment and care providers. Patients that use a shared care plan are less likely to feel excluded or confused when they go to see different providers like primary care providers, behavioral health providers, or substance use treatment settings. Shared care plans also represent a shift from what we traditionally call treatment plans, which are a list of items for a provider to ask the patient about from visit to visit. The shared care plan fully incorporates the individual patient's health goals, describes the strategies the patient has identified unique to them, individualized to them, and along with the team, explanation of how to support the patient to get to those goals. This video reviews the basics of creating a shared care plan. Now we're going to talk about what's in a shared care plan. And the plan should be designed to positively impact patient outcomes. And the plan really is focused on how to help the patient identify areas of their strengths and their motivations. So when we talk about strengths and motivations, it could be simply as what motivates the patient to come into the health center on any given day. Choosing an area of focus or the patient's intended change really helps identify their specific strengths of what it is that they want to work on. An example of identifying a patient's strength is a time when I was working with a grandparent who was struggling with high A1C scores for diabetes. They were not so concerned about the A1C scores or their diet or exercise, but what motivated them the most was being able to connect and play with their grandchildren. And that became the focus of the shared care plan, identifying their strengths and what it is that motivates them. Another component of the shared care plan is that it helps guide their visit with members of the care team. It gives them a shared language that the team understands so that they can talk to different providers about what it is that they're working on. It connects them to the treatment team, and it defines and empowers their role in self-managing their own health. An effective shared care plan is one that anyone on the team can use to support the patient. To encourage continuity of care, all team members should be able to follow it. The plan should include patient identification information and demographics, diagnosed medical and behavioral health conditions that are currently a focus of treatment, a full roster of the treatment team, including other patient-identified supports. These can be from the community, a patient's family, or a faith-based support group. A comprehensive list of all medications, and this includes over-the-counter medications and supplements, and regularly updated person-centered goals, and regular updates on the progress towards these goals. All this information in the shared care plan helps facilitate communication between everyone on the team. The shared care plan is designed to equip primary care and behavioral health providers with effective tools, a solid structure, and a personal confidence to practice team-based care and to better support patient goals and their self-management. There are a number of non-medical factors that impact a person's overall health and quality of life. These factors are referred to as social determinants of health. They include things like finances, housing, transportation, access to healthy food, community stability, and culture. We know that any of these factors influence what patients can focus on, want to focus on, and how they can improve their health. Integrated care teams need to be considering how these factors may play into the patient's perspectives on goal setting or self-managing their health. One example of a social determinant that impacted a patient's self-care plan was the fact that they didn't have electricity. Their medications needed to be stored in a refrigerator, and the providers couldn't understand why the patient was, quote, non-compliant with medications. When a community health worker worked with this patient to understand the financial stress that this family was undergoing and the fact that they couldn't pay for a refrigerator or electricity in their home, the treatment team was able to come together and come up with alternative ways to help this patient meet their shared plan goals. So here's 7 tips for implementing shared care plans. 1, keep the patient first. Remember, whose plan is it? It's the patient's plan. The shared care plan is always focused on what the patient identifies is as important to them. 2, start small. Start with one small self-directed goal as an instant motivator. Something that you think and the patient thinks they can accomplish within maybe the first 24 hours or by the next visit. This starts the momentum of change. It harnesses their ability to show that they can succeed and to make change. 3, stay focused. Resist overloading the patient and the integrated care team with too many goals. Sometimes the simpler the plan can be, the better off the plan will be. Number 4, communicate clearly. When discussing and reviewing the shared care plan with a patient, be sure to speak in the patient's language and engage team members who can translate if needed. Be mindful and respectful of cultural norms and family dynamics that are unique to your community. Number 5, keep it simple. When goals and notes are recorded, be sure to use simple language, easy communicable language that's understood by the patient and the entire care team. Number 6, take time to acknowledge improvements. Take the time to celebrate and talk about the wins. Change in progress is always something positive that can be built upon from session to session, from visit to visit. And finally, number 7, use your EHR. Embedded shared care plans within the EHR ensure that the team has the most visible access to the goals of the plan, can communicate with each other about the plan, and allows for charting of progress. A shared care plan generates data within the EHR that can be used to provide feedback to patients on how their health is improving over time. Tracking progress towards goals and creating a record of patients setting and meeting their health goals also provides outcomes to the team. Analysis of this data across teams or for specific patient populations or conditions can help a care team identify patient successes and potential areas of improvement. Consider setting up a pop-up notification in the EHR to prompt your team members to ask about or record progress on a priority quality improvement metric. In summary, a shared care plan is the formal agreement driven by the patient and is between the patient and all the members of their integrated care team. The care plan identifies what they are going to treat, how they are going to treat it, and how success will be defined and measured. The shared care plan serves as the guide throughout the process and provides a strong foundation for helping patients take an active role in improving their health. Thanks for watching this video, and thank you for the hard work that you do to help the people in your communities. For more specific information on shared care plans, be sure to check out our 2 additional video segments.